Okay, so hi everyone. These are the concept notes that I have for module 3. There's a lot of reading, but there's a lot of really good information that I'm pretty sure everyone enjoy reading and listening to. I have some key points. Hopefully, I can flow and connect them all together because there's a lot of information that I personally took note of. But first, I really want to start with the article from like the old article that we read, or it was, I believe it was the book. And it's funny in a sense because I feel like we all know that in every single movie or anywhere we can see that whoever takes care of people has some sort of witch or some sort of, magical stuff. So the way that I saw how everything transitioned was like finding that credibility in order to practice medicine from like what some people thought it was like witchcraft. And that was something very interesting, not only to read about because we, like I said, we probably have seen it before, especially me, I'm Puerto Rican, and like the indigenous and that culture, we all know that the person that knew how to like cure people, it was also the person that was pretty much like had some sort of communication with like ancestors and all that. um we can also see that kind of like indigenous part in like, this is so like, it's hypothetically and like an example, but like Avatar, like the same person or the same women that it's the one that like helps people that are, ill or anything. It's the same person that has this like ancestor connection. So it was very interesting reading this article and seeing how everything kind of transitioned, and how like the medicine worked its way to the credibility and accredited profession that it's nowadays. So also the fact that physics and the invention of the microscope were key points of building that scientific foundation system was also very interesting. I did not know that those two like pieces kind of did the push that medicine needed, to be something, to start getting some sort of structure, if I see. This, and like I said, like those made medicine and healing like teachable. So being able to teach it and being able to like evaluate, kind of, instead of the you had like, because you were the daughter or the son or someone, now you have the power to heal people. Like, no, like now you can actually learn it and then you can help people, and heal them, and and I feel like this part of it, it also kind of starts to put together the sociological aspect, not only because it was, some sort of how in this like social or community we can categorize a healer, but now it's education. So like now it has more accessibility, I guess, or like people can actually pursue that, and it's actually a career. So um then you also kind of saw that in the 20th centuries was like how the license and all that accreditation started to take shape and establish. And then the one of the things that I um one of the things that I was more impressed when reading of the terms, and the key aspects of like the sociology and health, it was when reading, or not reading, when we saw the video of the 10 keys, there were certain terms that like blow my mind, because one of them being sick, like being sick. I I I felt it, but like never thought about it of like a an actual way to prove to society or like anyone around that you're actually sick, and not only proving that you're actually sick, but like in order to fully consider that you're sick, you need to find ways to heal or get better. And all that concept of like not only being sick or being visually sick and all that, but also finding ways to feel better, that's how as a whole is consider the role of being sick. I feel like that was something that it really kind of blew my mind, and also made me think a little bit further, because in that aspect, okay, well, like I totally understand that in order to have that role of being sick, you have to feel better or find ways to get better. But how about the people that don't have access to it? Like, I feel like everything in healthcare is just like a cycle of things, because you know, some people just don't have the money to really find ways to feel better. And that does that mean that they're less sick, or like they don't have the ability to be in a like sick role. um and yeah, that one just like blew my mind. Also the medicalization also, I was very, because like I kind of related to both, because the example that it used for ADHD, I totally understand it, because as a person that was diagnosed with ADHD at 28, I for 28 years I thought it was just, it was my part of my personality, and certain behaviors, it was just part of who I was. And then all of a sudden I got like I this diagnosed, because I just felt like a lot of people with the same behaviors that I had, they were getting better because they were being treated for it. And I was like, oh, you're telling me that that's not just my personality, like that's something that is treatable. And that was something super funny, because I saw that and I felt so related to that. But that's very interesting to understand and know the relationship with sociology and healthcare. But the other thing that, of course, it was very interesting to read and learn about was the evolution of healthcare system throughout the years. Like reading an article that it was from like the before 2000, so it was in the 1900s, and it was talking about the different challenges and like healthcare system and all that. And it's kind of crazy that it's kind of the same problems ish. Shortage, we need to get more healthcare workers, we need to improve this and this. It's just like now it feels like it's in a bigger scale. Like before it was like a couple of them, now it's like bigger numbers, like more people, we need more access and more affordability. And like there's like policies and things that are made in the government that probably could potentially help, but it always helps a little bit, and by the time that it should kind of help more, we need more. Like this is something that is just it just keeps growing. And learning about the healthcare system, I was really, to be like, okay, so learning about the healthcare system is something that I was very, like, I've always been interested in working in the healthcare field. Just that for me, for some reason, learning how the actual healthcare system worked and how to make it flow and all that, it was a little bit too complicated for me to understand, and I thought it was just me. But reading through and seeing the videos, I was able to understand that it's just a complex system that you don't necessarily need to learn in one sitting. Like it's something that I now, with all this reading and the videos and all that, they were very helpful for me to understand that it's just something that I need to continue on revisiting, because not only is complex, but is constantly evolving. So the resources provided this week, they were very helpful. Definitely learning more about each agency behind like the healthcare system, and also like breaking down the US healthcare system and like who pays for the healthcare and how the premium works, and the employer healthcare, like how that's pretty unique in the US versus other countries. It's very interesting. The only thing that I do want to note, and it's something that I don't know if it's just me, I struggle a lot with videos like the one for the two physicians that were talking. It had a really good context. However, they deliver it in a way that, like, I feel like it wasn't meant to for the general public, if that makes sense. Like, yes, it's in a YouTube video, yes, anyone can access to it, but it was like a physician talking, and still using those terms that could be confusing for someone that is not used to that environment, if that makes sense. Like, I could give you to give you an example of the type of videos, at least I enjoy a lot watching podcasts and learning, but I need you to like treat me like I'm a 5-year-old. Like, I need like the crash courses, perfect. I was able to see that once, take notes, and probably see it a second time. But the two physicians ones, it's not that it was, but like it wasn't a lot of information, so it shouldn't be that complex. But because they were going back and forth, and because they were like kind of just casually two physicians talking to each other, in my opinion, I just felt that like I was mid video, I was lost. So I had to like kind of make notes word by word in order for me to like kind of simplify the terms and be able to understand it better. And the reason why I mentioned it is because I feel like a lot of people should have access to this kind of information in a very simple way. Because I know that if you in one sentence throw 3 or 4 complex words, you already lost complete interest of someone that is not even a physician or is not even in the healthcare system. But yet you're also, as a citizen and as a patient, you need to have a health insurance, and you need to have some sort of knowledge in the healthcare system. Yet everyone knows it's complex, but no, like I don't feel like there's enough information in a way that is very simple for anyone to understand. That's like how I perceive it. That video specifically, the other ones were pretty straightforward, pretty really good information. I know one of them was more of like, this is the numbers now, we'll see what the Affordable Act will do. And then the other one was more like telling each, like Medicaid Advantage, and all, like it's the parts of the insurances and all that. Definitely the reading, did help a lot. And then the article that I enjoy the most was the state scores. And seeing all the numbers, like seeing the fluctuation between states, like even though it's the same country, there's no consistent system that follows like all of the states. Like they all have some sort of, like, even the ones that have really good scores or high scores, they do have some they're lacking or having some not very strong areas. The one that impressed me the most, that it was in the top 5, was Hawaii. And the reason why it interests me, and I feel like I will be researching more about, is because, like I said before, I am from Puerto Rico, so it's an island, and I know in Puerto Rico they're struggling a lot with all kinds of healthcare. There's not enough healthcare providers. There's no enough healthcare staff in general. Hospitals are closing. Like, it's just really bad management left to right. And yes, Hawaii is a state and Puerto Rico, it's not a state. But given the fact that they're both island, and Hawaii has the opportunity to provide to be in the top 5 of all the states in healthcare. It's something that I'm definitely gonna continue on looking forward. But that was such an incredible document to read and to understand and kind of see how certain states that were not doing the Affordable Act were more in the lower scores, and then the ones on the higher scores have like a lot of consistent numbers, yet there was like one or two parts that they were not too high, but overall they were doing pretty good. I also was able to learn the correlation and the emphasis of providing healthcare to everyone. I feel that's something very important, and they did mention how research is showing that the people that had access to any kind of healthcare are more likely to be on top of their health, and then do not follow on like higher expenses later on, because they didn't have the accessibility or the resources to find a provider, or to be in constant relation or in constant contact with the primary care, which are the ones that can actually tell you if there's anything wrong or so there's a lot of very interesting information. And like I said, since I am taking a U.S. healthcare system course and I'm reading a book, so this is the book that I'm reading for the U.S. healthcare system class, and we actually have free access to the book through the UCF library. So if you're interested in reading more of the U.S. healthcare system, that's definitely, I'm already in chapter 4 with that class, but you can read it in your own pace, and it has really good information, talks about revenue and all that. So it's a really, really good resource besides the ones that we're reading on class. So if you find it, I will put it in the description or the comments here, so that you can also find it in the UCF library and give it a try. It really has really good information. But yeah, those are the concept notes that I have right now. Will continue on. I will continue on reading more. But like I said, it's very impressed how we went from like witchcraft and all this like kind of healer, thing, to what a doctor is right now. So hope you have a great day and good luck on the next module.